thanks very much for agreeing to speak to us today, Laura. And if you can start by you telling us a little bit about yourself and what you actually do in your role.
Lovely, thank you. Thanks both for the invite to have a discussion with you today. So for those of you who don't know me, my name is Laura Jess. I am a clinical scientist in respiratory and sleep, and I'm currently the head of paediatric respiratory and sleep physiology at the Royal Hospital for Children and Young People in NHS Lothian. I have some additional roles, so I'm currently the chair of the ARTP Scotland Committee. For those of you who don't know, the ARTP is the professional body for respiratory and sleep science in the UK, and I currently sit on the ARTP Executive Board as the Events Committee Chair. I've worked as a physiologist for 18 years. I have been in science. I've had a science background for almost the entirety of my career, but I've specifically worked in healthcare science for about 18 years, and I've been involved with sleep physiology for around about 10 years, and previously led the sleep medicine service for NHS Lothian prior to the current role that I'm in.
Busy.
What a CV there, that is fantastic. What do you see has been a change in the last few years in the recognition of how the physiologists actually contribute to the sleep medicine diagnostics? Because it's different across different services in different countries as well.
It is, it absolutely is. And I think that what is probably one of the things to highlight is actually how crucial the role of healthcare scientists, so physiologists, clinical scientists, is in the diagnosis and treatment and management of sleep disorder breathing and sleep apnea. So I guess, you know, what is particularly important to this discussion is to think about the scientific expertise that we provide in all areas of the patient journey. I think first and foremost, the diagnostic role that we provide. So in terms of conducting the sleep studies, analysing the data, and conducting the clinical assessments as well. And I think that we're seeing more and more of that aspect coming through as technology changes, and with the introduction of things like AI and tools to support the diagnostic aspect. I think that the second part of the role which we provide that is, you know, particularly crucial is the treatment and management side. So consideration for managing CPAP therapy and positive airway pressure, supporting other therapies as well. And I think something that is often missed is around the patient education aspect and being able to, you know, really holistically support that patient empowerment aspect of the journey and their own treatment as well. And I think that lastly, you know, healthcare scientists have such a crucial part in collaborative working with other professional roles. So, you know, working within that multidisciplinary team, supporting other staff, and often something that sits in the background as well as the quality control aspects of the patient journey that are maintained. So yeah, I think we can probably describe ourselves as a bit of a jack of all trades, and we have so many parts to play in that patient journey. I
mean, I think that it's such a crucial role for sure, and I think a lot of people just don't realise how much you actually contribute to the overall MDT working in the team. Adrian, have you any questions you would like to ask Laura?
No, it was eye-opening, and I profess ignorance, so thank you. I mean, so bringing it back then to what we're talking about, the awake check. Come on, what's your perspective, please, Laura?
So I think that my perspective, first of all, is that it's something that can be utilised, that can provide equitable access in terms of basically, you know, health and sleep screening, and that's something that's so important. I think that what it does is it helps to provide the risk or identify the risk in such a short space of time, and that is extremely important when we consider how long waits can be in health, and being able to identify that risk in a short space of time is extremely important. I'm not sure that there is actually such a great awareness of comorbid insomnia and sleep apnea, and I think that there's so much education and, you know, awareness emerging around that. And when we think about the prevalence figures for sleep apnea, in that there isn't necessarily good prevalence data, I think that what is particularly important is that we can identify where there is a risk and provide patients that opportunity to a much more timely diagnosis, treatment and ongoing care. So it's absolutely about what tools that we can use to help support all aspects of the journey. And also something which is extremely important to me is something that's evidence-based and research-led as well, having a science background. For me, that is something that is very, very much at the forefront. We know how important subjective assessments of sleep are, and how vital they are in terms of clinical assessment. So it's absolutely something I think that can be used in conjunction with those tools as well.
Okay, cool. Thank you.
Anything else you want to comment, Adrian?
No, I mean, for me, this has been really informative and very interesting. Thank you. And I just want to say, yeah, the Awake Check is pitched at the beginning of the journey. That's it. It's an awareness and interest thing. And didn't know. And then hopefully then the path just follows. That's the objective. So awakecheck.co.uk. I'll say thank you very much, Laura.
Thank you, Laura, for joining us today. Yeah. It's really great to catch up, and I'm really looking forward to the ARTP in Belfast.
Congratulations on the award, Laura.
Congratulations on that award. Flying the flag for the healthcare scientists of the UK. Well done, Laura.
Thank you very much, and thank you for inviting me today.